Hi OSU. I assume if you're here, you're planning on concept mapping Miss June, and you remembered my instructions that said I want you to set it up exactly like I do, just so it'll be easier to grade. Excuse me, and we'll all be on the same page. So here's my concept map. It's not by any means complete. It's just a partial one to kind of get you started. I will say that if you don't have colored construction paper, it's no big deal. You don't have to use color. If you are going to use color, though, if you've ever wanted to use color in your concept map and you didn't really know how, this will be a good demonstration for your next concept map or for next semester. If you use color, it needs to be meaningful other than just looking pretty. And so I'll explain my color use as I go along. But like I said, if you don't have colored paper or you don't have colored markers, that's okay. You don't have to have that part, but I do want you to set it up like I did the rest of the way. So starting up here, and I'm going to read these to you because I don't know that you'll be able to see them well enough. So this is my information about the patient. So up here it says June Colbert case study. I know normally you don't put a patient's name on here, but you can go ahead and put hers. That will help me know that this is one of those rheumatoid arthritis case studies. And then down here, student name. So I put Charlotte Barker, you'll put yours. Date of admission, you can put 2 days post-op, put her age, gender female, admitting diagnosis. So fill that in, and then history of present illness. That's where you'll discuss her rheumatoid arthritis. Okay, so for my color, I used a different color for each of my nursing diagnoses. You have to have 4, and one of them has to be knowledge deficit. And you do not have to use the same ones I did. You're certainly welcome to, and it would probably make it easier because you can copy some of my stuff. But I'll tell you the ones that I used. I have acute pain related to, and I didn't fill that in yet. So if you are copying me, I didn't do all of your work for you. Impaired mobility related to, I don't have anything on my yellow yet. And then here, my favorite psychosocial diagnosis, knowledge deficit related to. So if you use the same ones that I did, that's fine. You just have to, you can't put related to ... You actually have to fill that part in. And so then also on my little colored squares, I have my outcome statement. Now, Crystal kind of explained this in your concept mapping class, but I'm going to just recap. Your outcome statement is a single umbrella statement that encompasses your 3 performance criteria. The outcome statement doesn't have to be as measurable as the performance criteria. It's the performance criteria that make your outcome statement measurable, okay? So you need 1 umbrella outcome statement for each of your diagnoses with 3 performance criteria. And I think an example will be better than trying to explain it. So for acute pain, my outcome statement says patient will have a decrease in pain by the end of the shift. So not real measurable, right? How would we know they have a decrease? Well, then that's where your performance criteria come in. And you have to have 3 performance criteria. They have to be very measurable. And so I have performance criteria, and this is an index card. And you'll notice I use about 9 index cards on here. And because it'll make your writing a little bit neater, you have lines. So lined index cards, you need 9 of them. And 1 piece of lined notebook paper. So on my performance criteria, I put on the very top line, patient will, and then a colon, because for each of these 1, 2, 3, they should all start with patient will, because that's kind of your definition of a performance criteria, is it something the patient will do. So patient will, number 1, state or perform 2 non-pharmacological ways to help with pain this shift. And number 2, again, patient will rate pain no higher than 5 out of 10 this shift. Whenever you write your performance criteria, go back and look at them. Are they measurable? Because, for instance, if I change this state or perform to patient will know 2 non-pharmacological, know is a verb that is not measurable. We can't measure if a patient knows something. So what we can measure is if they state something or if they perform something or rate. So make sure that you use verbs that are measurable on your performance criteria. So I have 2. And again, if you decide to use acute pain, you can certainly use the same performance criteria, that's fine. Each of the little ovals are my data that go with each of the diagnoses. So they match the color, and that makes them real easy. So that's where color can kind of come in handy. And so my data for acute pain, I have a whole bunch. And sometimes I think students don't think of all of the things they can use. Everything's up for grabs. History, present tense, future tense, any orders that they have. So listen to all of the things I have for my data. Rates pain 7 out of 10. Moaning with movement. Guarding of extremity. Reluctant to ambulate. Reluctant to use CPM, that's continuous passive motion. Reluctant to participate in physical therapy. Crying. BP and heart rate elevated. Prescription for Toradol related to pain. Prescription for Norco related to pain. History of recent surgery. History of rheumatoid arthritis. So those are all of my data, and you can see that I have way more than 6. And so a lot of those things, written prescriptions, histories, all of that can be used in your data. And then, well, we'll get to it. Let me do my connections now. So I've gone over nursing diagnoses, outcome statements, data, performance criteria, our opening. Now I want to do connections. So one of the things that it seems that students skimp on is the connections between the diagnoses. You're really supposed to connect all of your diagnoses together. And it's really supposed to be done on lines. That's what makes this a map. Students kind of like to have everything in a nice straight line, or they like to have all of their diagnoses lined up here and then all of their information down here. Well, that's not a map. A map needs to have lines interconnecting things. It needs to look like a spider's web. So the cool thing about using color is I used that to highlight my lines. So my impaired mobility, which is green, where it connects to this diagnosis, which I don't have anything here yet, there's kind of this lime green, like if you combine green and yellow line, and then I could write on it. Where my acute pain connects to my knowledge deficit, so I have a red acute pain, a blue knowledge deficit. So if you combine red and blue, you get purple. So my purple line connects those two. And let me read to you what I have. Oh, you can't see it, can you? There we go. Let me read to you what it says so I can get you used to how you can connect your diagnoses. So we have acute pain, knowledge deficit, purple line, connecting them I have. Patient can be taught non-pharmacologic methods of pain relief. So taught, knowledge deficit, pain. Second sentence, patient also needs to know to accurately take analgesics at home. So again, the word know goes with knowledge deficit, analgesics goes with pain. And then I have another one over here. Poorly controlled pain decreases the ability to learn. So those are 3 different connections between pain and knowledge deficit. Where I connect my red and my yellow diagnosis, if you combine red and yellow, you get orange. So I have this nice little orange line. Of course, I haven't picked a diagnosis for here yet, so there's nothing there. Where red and green connect, well, if you mix red and green, you get brown. And so I have this little brown line between acute pain and impaired mobility. And it says, pain will cause reluctance to move. And then a second sentence says, immobility will increase joint stiffness, resulting in increased pain. So 2 different connections between my red and my green. Where my green connects to my blue, I made a little teal line here. So impaired mobility connects to knowledge deficit. I put teaching the patient about the complications of immobility will increase compliance with treatment. So that's my connection there. And so each one of these diagnoses, you need to try to connect them to each other. So that's where you get all these lines. Okay, so the next part would be interventions. Well, let me go over the performance criteria that I have over here first. So for impaired mobility, my outcome statement says, patient will have no signs and symptoms of complications of immobility this shift as evidenced by, and then I have index card. It says performance criteria, patient will, 1, 2, 3. Number 1, patient will complete all prescribed physical therapy exercises this shift. Is it measurable? Yep, sure is. And so now I can start on my interventions. So just like I have patient will on my performance criteria, for my nursing interventions, they all say nurse will, because every nursing intervention should start with nurse will. And then over here, after the little red line on the notebook paper, I have my delegation and collaboration. So who does what? So this first bullet point I have, nurse will assess pain, Q2H, so assess pain every 2 hours using a numeric scale and noting location, quality, aggravating and alleviating factors. As for my delegation and collaboration, really just the RN on that one. CNA can't assess. Physician doesn't really come into play on the assessing here. So just RN. And then my second one, bullet point here, I have encourage use of analgesics 30 to 45 minutes before physical therapy. Now here I can have more delegation and collaboration. I need to have the healthcare provider prescribe the analgesic, right? And then I also have physical therapy in here because I'm coordinating with them to get the pain controlled so that the patient can do their physical therapy. Now here's where students don't want to comply. For some reason, a lot of you do not like writing on these little connecting lines, but I want you to do that. First of all, it's way, way easier for me to grade when I have a line going from nursing intervention to the specific performance criteria that it's addressing. And so it's way easier to grade it, and you learn better doing it this way. So here I just drew on this first one, assessing the pain. I drew a line over here to my performance criteria that says rate pain no higher than 5 to 10 this shift. I didn't put a rationale on that. So that was, if you use my suggestions, you'll have to fill in the rationale. On the second one though, I have filled in rationales. And that's because this intervention, encouraged use of analgesics 30 to 45 minutes before physical therapy, goes 2 places. So it can go up to this rate pain no higher than 5 out of 10 this shift. And it also can go down here to my performance criteria for impaired mobility. Complete all prescribed physical therapy exercises this shift. However, instead of having 1 rationale, I have 2 because it goes 2 different places. So this rationale says unrelieved pain hinders the rehab process. And this rationale says if pain is too severe before analgesics are initiated, relief takes longer. So 2 different rationales because it's going to 2 different places. Okay, so the last part that we haven't talked about, I don't have time. Oh, better hurry, I got 1 more minute. That's the evaluation, and this is going to be the fun part because you get to decide what happens next. It wasn't in my case study, so you decide, do your interventions work or do they not? You get to make this up. So for my intervention of state or perform 2 non-pharmacologic ways to help with pain this shift, for my evaluation, I put met. Patient requested an ice pack and said it helped, and watched all 3 original Star Wars movies to provide distraction. That would distract me. I love those things. So you make this part up. So again, recapping real quick, we have 4 diagnoses, preferably on different color of paper if you have it. If not, maybe you can take a colored pencil or marker and draw around it, give it a little colored border, and then a matching data for each one. Then take index cards so you can write neatly. Performance criteria 1, 2, 3. Evaluation 1, 2, 3. Next diagnosis. Outcome statement. Performance criteria 1, 2, 3. Evaluation 1, 2, 3. Diagnosis, outcome statement, data, performance criteria 1, 2, 3. Evaluation 1, 2, 3, and so on and so forth. Connect all of your diagnoses and draw lines connecting your intervention to the performance criteria. Every single performance criteria, so you should have 12, needs at least 1 nursing intervention. All right, I'm out of time. I hope I didn't sound too stern. I'm looking forward to reading these. Take a picture so we can see the whole thing at once and turn it in to your advisor.